Hi, I'm Karen Frazier. I'm going to do an abdominal assessment on Justice McWilliams. This is for class NU 518. Justice, do you give me permission to video record you and upload it so that my professor can grade it?
Yes, ma'am.
All right, so I already have the, scan the room all the way around. Okay, thank you very much. I already have the patient where the curtains are pulled, the doors are closed because I do want to provide privacy for the patient. I do have the patient draped, so if there's any coldness in the room, the patient will be covered also for privacy. I have the patient in the correct position with the knees bent to do an abdominal assessment. I'm going to now uncover the stomach, just exposing enough that I could do my assessment on the patient. All right, so the first thing that I'm going to do is inspect the abdomen. I'm just going to look at the abdomen, looking for any abnormalities, such as masses, such as the patient's pulsating, any piercings, any abnormal moles, anything that would look abnormal on an abdomen in a patient. And so that's my inspection part of my examination. The next thing that I'm going to do is auscultate. I'm doing it a little bit out of series because I don't want the patient to have any artificial bowel sounds from me percussing or palpating first. So I'm going to auscultate first. I'm listening for bowel sounds. Okay, so the patient does have good bowel sounds, so there's no use in me going farther with listening at all four quadrants of the abdomen for more bowel sounds because I am to assume that he has bowel sounds in other places. I'm going to also listen for bruits. I'm going to listen with the bell of the stethoscope. I'm going to check the aorta, the aortic portion of the abdomen, which is right above the umbilicus. Then I'm going to proceed to the right and the left upper quadrants of the abdomen. Just checking for renal bruits. Which he's -4, so that's good that he has no bruise in the abdomen. The next portion of the abdominal assessment that I'm going to do is percuss. All right. So I'm going to start on the right side. I'm going to percuss over the liver area. I'll percuss from the inferior of the abdomen and work my way up to the superior of the abdomen with the mid-clavicular lining. Okay? It should be a nice tympanic sound that I hear. Okay? And my sound changes right about there. So right about here, I'm going to measure this just to make sure it's a normal size liver, right here, and that it is. It's at about a 10.5, which is a normal size liver for an adult male. The next portion of the abdomen that I'm going to percuss, I'm going to move over to the spleen side of the abdomen, and I'll just listen for the sound here, which should be very similar to the liver side. It should be nice and tympanic, and that it is. The next thing I'm going to do, I'm going to go to the palpating portion of my examination. I'm going to start with a light palpation. Nothing too hard, nothing too deep. Any tenderness?
No.
Okay. So the next part of the exam, I'm going to go into a deeper palpating where I'm going to place my other hand on top of this one just to go a little bit deeper. Maybe a little bit uncomfortable for the patient. His skin is nice and warm and dry. All right, I want to move over to the right side of the abdomen where the liver is located. I'm going to palpate right up under the right rib area, which is the mid-costal area. A little bit deeper. I want you to take a deep breath for me. Any tenderness when you take a deep breath and I push on your abdomen?
No.
Okay. Then we're going to move over to the other side just to do the same thing. I'm going to go right up under the rib cage area, the mid-costal area, just to see if the patient experienced any tenderness. So take a deep breath for me. Any pain?
No.
All right. Secondly, I'm going to also have Mr. McWilliams to take a deep breath while I place my hand at his right flank. I'm going to also palpate a little bit deeper on this side. Take a deep breath for me. Any pain?
No.
Okay. So then I'm going to move over to this other side and I'm going to place my hand on his left flank. And I want him to take a deep breath for me. Deep breath. Any pain?
No.
All right. So I have now palpated the right side and the left side of his abdomen where the liver is located and also the spleen. I want to palpate in the center right above the umbilicus. Just checking for any tenderness around the aortic area. Take a deep breath for me. No problems, no tenderness, no pain there? No? Alrighty. So, palpated just to see what the width of the aortic is, and everything checks out to be very normal. The skin is the right temperature. Don't see any abnormalities concerning masses, nothing bulging, pulsating, nothing that looks abnormal there. I'm going to have the patient to sit up for me. I'm going to percuss the back kidney area, the left and the right kidney. And Mr. McWilliams, you just let me know if you experience, sit up straight, if you experience any tenderness when I do this, okay? So I'm going to push up here on the right kidney, and I'm going to take my fist. Any pain?
No.
All right, I'm going to push up on the left kidney side and do the same. Any pain?
No.
Okay, so no pain there. That examination seems to check out normal also. And that concludes my abdominal assessment for NU 518. Thank you.